lot of different experiences around cultural competency and prevention. So I think that's great to have a diverse audience like that. The objectives for today's webinar will be first to talk about how you build capacity for cultural competency, and I'm going to talk about it from the individual as well as the organizational perspective. And of course, cultural competency contributes considerably to having those positive prevention practice outcomes. We're going to talk about cultural adaptations to prevention activities and how you can do that throughout as you move through the strategic prevention framework. And to get you thinking hopefully about how you plan to address cultural competency at each step of the SPIF with the communities that you work with. I want to start by talking a little bit about some common terms that we use all the time, particularly when we're talking about cultural competency. The first, of course, is culture, and I have up there a dictionary definition of what culture means. And you can see it's an integrated set of beliefs, values, and behaviors and language. And that's how we commonly understand what culture is. We often use culture and ethnicity interchangeably. However, what I'd like to just get you thinking about is that ethnicity is more than just culture. And you see from this definition, you're talking about a social identity that may be formed because of where you live or grew up, that provides a mutual sense of belonging. And often that's identified with a place. You know, you may come from a country outside of the U.S., you may identify yourself as a Southern American, and so forth and so on. That's where ethnicity differs. We tend to think of the two as being the same, and that can sometimes create problems for us when we begin to talk about prevention and assessing the needs of a community. It's important to disentangle some of the overlap between race, ethnicity, and culture. In our culture, race is really a social construction based primarily on skin color. And what's interesting is that when we self-identify, often, at least for people of color, race comes first. You are an African American, a Native American, an Asian American, etc., etc. Whereas in many other countries, it's your nationality that comes first. I have a lot of friends, and my husband has a lot of family from the Caribbean. And if you were to ask them who they identify with, they're going to say that they're Jamaican, they're Puerto Rican. So race is secondary in many cases. So understanding that is important too, because if you don't begin to really differentiate and kind of tease that apart, what you can wind up doing is a kind of profiling where you're imputing behaviors or belief on the basis of the race alone, which is, may not work in all situations. Clearly, our life experience has a lot to do with how we view the world. So if you grow up in inner city Detroit, you have one perspective. If you grow up in the wilderness of Alaska or in the rural areas of Montana, you have another perspective. Similarly, if you grow up in a very suburban environment that's very self-contained and homogeneous in terms of demographics, your perspective is going to differ. So all of those things feed into the way we see the world and the way we react to it. Now, cultural competency, as we're discussing it today, is one of the most important principles within the SPIF, and it's a cross-cutting principle along with sustainability, which means that it is something that can be done at each of the 5 steps of the SPIF. And I'm going to talk a little bit about exactly what that means in terms of practice. So let me stop here. I believe we have a poll question. What does it mean to be culturally competent? What do the words mean?
We'll take just a second here to give everyone time to complete the poll question. You may have to scroll down to see all of the options. So it looks like several of you have chosen all of the above. About 79%, and that keeps changing. Some of you have chosen, one of you chose using data to identify disparities in incidence, consequence, or outcomes amongst the populations in the community. 13 of you chose self-awareness of how my own culture and life experience influences my perceptions and interpretation of the world. Not being racist, no one chose that. Addressing the barriers to effective recruitment, retention, and intervention within the community, no one chose that. So, and again, so now it went up to about 80% of you chose all of the above. So what's the answer?
Well, the answer, I think, is really all of the all of the above. So it's good to see a lot of you had checked that particular response choice, because it really is a combination of being able to analyze data to see where the disparities in outcomes are, but it also means being aware of how your own life experience and cultural background have influenced the way you view the world. Now, SAMHSA defines cultural competence as the ability of an individual or organization to interact effectively with people of different cultures. So for SAMHSA, this is very practical. It's not so much about attitudes, although attitudes are going to be a part of your ability to work with people of different cultures. The bottom line is, can you relate to the communities that you serve when there are diverse subpopulations that have cultural perspectives different from your own? And so we'll talk a little bit about what that means too. So when we talk about the cultural competence continuum, sometimes we tend to think that cultural competence is something you just achieve. It's like you get a degree or a certificate. I saw from the poll early on that many of you have attended cultural competence trainings before. Well, the question is, does that make you culturally competent because you understand the concept? And where would you find yourself on this continuum? And that's just something for you to think about. For those of you who are not familiar, the destructiveness end is really where people have a bias which creates or harms the population that they're trying to serve. They may hold with some very negative stereotypes, or they lack respect for the cultural values of a community, and it does harm. So that's where destructiveness is. Incapacity means you do understand, a person does understand that there's a need to really look at cultural differences and maybe do something about it, but they're at a loss as to how to do it, or may not have the skills or the adequate resources to be able to move forward. Blindness is something that often occurs. It's been interesting to kind of read some of the opinions around racism that are coming forward, and as people try to define what that means. And one of the choices on the poll was, "I'm not a racist." Blindness means that you don't see the differences, or that you don't value, understand, or know why they're important. And that can also be very destructive, because there are differences, and in some cases, understanding those and working through them with members of your community can make you more effective as a prevention practitioner. Pre-competence is where I think most of us will fall, and that is You know you have to do something. You're beginning to look for resources. You're going to trainings on cultural competency. You're trying to apply those trainings. So you're trying to move forward till you get to that last box, which is cultural competence. The reality is that most of us never get to the last box. We're always working toward it, and that's a good thing, to be working toward competence. The other thing is there are so many different subgroups in this country. It is literally impossible to be competent with every single one. But your approach to understanding and the tools that you can use to help you understand will move you along that continuum in a very meaningful way. One of the things one of the guides that we often refer to are something called a class standards. And these class standards really refer to organizational competencies. And it has to do with governance and leadership, communications and language, engagement, continuous improvement, and accountability. Under governance within an organization, that means actively supporting the class standards, and some of you may be familiar with them. There are a number of guidelines within each of these domains. But it also has to do with a willingness and an ability to recruit a diverse workforce, support and retain that workforce as well, and providing ongoing education and training in order to grow leadership in cultural competence. Communication and language assistance is what we think of first when we talk about cultural adaptations, and that is looking at where you need perhaps to have materials translated. You may have signage or graphic images that have to be aligned with what's acceptable to a particular cultural subpopulation, and how you promote, what channels or venues you use to promote your strategy, how you do it, who the stakeholders are, etc., all come under communication and language assistance. The last category, continuous improvement and accountability, really has to do with quality control and continuing to engage the diversity within your community to help you understand how it's changing, where you're kind of on target versus where you might be missing the mark, and also to hold the organization accountable for what you do. So going back to all the standards and kind of doing a checklist to see where are you with regard to organizational cultural competence. So how do we build capacity? Well, first of all, many of you checked the option that training and self-reflection at the individual level is very important. And I agree with you on that. It is very important. I think I see some questions. Okay.
I think Concha had a question. She says, destructiveness is doing to someone. Are you seeing that one?
I see it. And incapacity is also doing to someone. I'm not sure what that was. Blindness is doing for someone, and precompetence and competence is doing with someone. And I agree. Yeah, that's absolutely true. Okay, was there another question I might have missed?
No, that was it.
Okay. Yeah, and I believe the slides will be available. I see Alice has asked that question. But going back to this whole idea of individual versus organization, as I mentioned, the class standards give us a guide for making our organizations more culturally competent. But each individual who's moving along that continuum has a responsibility and needs to make a commitment to ongoing self-reflection. You know, how are my own life experiences, my own cultural background affecting the way I see others? And that's very important. One of the strategies that you can use to make yourself more culturally aware and more competent in dealing cross-culturally is to go directly to the community. Identify cultural brokers, who are those individuals or organizations who are very knowledgeable about the populations that you are serving. Opinion leaders, those people who everyone tends to turn to and who are very credible within the population, as well as other community stakeholders who can offer you their perspective. Many times when we're in, Michael Patton, who is an evaluator and someone I love to read, talks about reflexive screens between those of us who are doing research and evaluation, those who have commissioned those activities, and then the people who are most affected, the participants in those studies. And each of those screens is composed of a number of different factors. And sometimes it's very difficult to look through the screen of another group. We see only what our background has taught us and not from the perspective of those who are actually living in the community. And again, listening to all of the discussion around Black Lives Matter and the many opinions back and forth, it's interesting how that's regarded by people who've had that life experience, have lived through some of what that is about, versus those who have not. And it really doesn't have anything necessarily to do with race again. It's just a matter of the screen through which we're viewing the phenomenon. When you're engaged in a community, it's also important to provide support for participation, creating a safe environment where people can come together and feel comfortable airing their perspectives. It may have to do with, where the meetings are held, not having them necessarily come into an organization that they may feel is not particularly friendly, but bringing the discussion to them in the community can be very important and very helpful in facilitating that open communication. So considering where it's held, when it's held. I once did a seminar with some folks, and one of the participants mentioned that he was working in HIV prevention and wanted to work with sex workers in this particular community. And they were typically having their meetings and groups either in the morning or in the afternoon, 4 or 5 o'clock, which, for working people, that the 5 o'clock typically works. For people who aren't working, the morning might work. But for sex workers, of course, they're just coming in from work early in the morning, and they're getting ready to leave for work late in the afternoon. So he found that doing it earlier in the afternoon increased his participation as well as the retention rates. So these are some very simple things that you can do, which are cultural adaptations and may make you more effective as a practitioner. When you're working to outreach and engage the community, what's very important is that you are inclusive and strategic in the way that you engage people. And there are different levels, and many of you have probably seen this particular continuum before, maybe even this slide, because I know a lot of people use it. But not everyone is going to be able to work with you on an ongoing basis, attend monthly meetings or keep up with the day-to-day decisions that you need to make. So as you think about who can provide the best kind of input to the work that you're doing, you think about those who may just need to be in the loop so that they feel included, with opportunities for them to participate when they want to, or when you have a particular question, which is those first two boxes. Perhaps someone has specific expertise, like your cultural brokers, for example, may be very critical for you when you're in the planning stage to help you understand the cultural differences and what adaptations might need to be made. Others will be more actively involved and will actually help you make decisions, review materials, help you with evaluations, and help you to actually deliver the interventions to the community. So you're looking at concentric circles, with the core of those concentric circles being the people that you feel that you can rely on for input throughout the process, as you move around the SPIF framework. One of the issues that always comes up when we talk about cultural competency and adaptation is, how do you balance fidelity, which is, you're implementing an evidence-based program, and so it's very important that you are consistent and that you implement the components of that program the way that they were intended to be implemented. You use the same materials, you use the same general approach, and content to your intervention is very important. But there are times when you will need to adapt some of those components in order to make it more culturally responsive when you're dealing cross-culturally. But you've got to balance the two, because if your adaptation compromises fidelity, then you're going to lose effectiveness, and that can be pretty tricky. Now, cultural adaptation, this is a definition here, the systematic modification of an evidence-based treatment or intervention protocol in such a way it's compatible with the client's cultural patterns, meanings, and values. So cultural adaptation can be, there are many different types or levels of cultural adaptation. Well, how do you decide what's needed? Well, these are some questions you can use to make that decision. Will adaptations eliminate or reduce cultural barriers to recruitment, retention, or effectiveness? So what's going to be most important is that you have gathered the information about, or gotten some input from the community of interest, from your focus community, in terms of cultural needs, cultural differences, and perspectives that may influence the way you recruit someone, the materials you use, what will help you to retain those participants, and ultimately what might make you more effective with the particular population. The big question here is, are adaptations feasible? And that has to do with your own skills, your resources that are available to you to make those adaptations, budget, which is a big one. Budget, which is a big one usually for most of us, as well as time. When you are funded by, say, a federal source or federal grant, there's a lot of pressure for you to get things done, right? You have to provide a work plan and say you're going to make X amount of progress within a certain time frame. So you feel pressure to do that. And when we begin to think about planning for cultural competence, well, that's time consuming. It's not necessarily something that you can do within a short period of time, because it takes time to identify where the disparities are, to decide who can best inform your intervention, getting those people together. All of that takes a lot of time. So you're spending a lot of time just gathering this information, looking at your data, identifying those subpopulations. So there's some hard decisions you have to make here, and sometimes the adaptations are not feasible. And then, of course, there's this whole issue of fidelity versus adaptation. And will the proposed adjustments compromise those basic elements of the evidence-based strategy? Now, often at this point, you may want to engage with the program developers or look at the research literature to see if this particular program has been piloted with a population similar to the one that is the focus of your intervention. And you have to make, again, some judgment calls in terms of which is more important, maintaining all of those core elements, or changing or modifying some of them slightly so that people will come and take advantage of what you have to offer. And again, you can call upon your cultural brokers and your other community stakeholders to help you with those decisions. Now, there is such a thing as a cultural adaptation continuum, just like we talked about cultural competency as being on a continuum. And the first level is where you don't make any adaptations at all. The program as it's designed seems to fit quite well with the population that you're serving. At the next level, you're talking about what is called surface or structural modifications in the program. And these generally don't compromise the core elements of that evidence-based strategy. So you may be talking about things like translating materials, for example, changing imagery to make it more congruent with the values of the community you serve. Deep structure modifications go a little bit further than that and may involve integrating cultural elements into the intervention of the program that you're implementing, which really requires some major changes in the way that materials are presented, or may add components that will be more that will make the intervention more acceptable to the populations that you're focused on. Culturally grounded adaptations are those which actually emanate from the culture that you're working with. In other words, they create it or co-create it with you so that it becomes a totally new kind of a thing, which is totally, which is definitely a part of, the culture. And I see a question from Elizabeth. Okay. I'll have to think about that one, Alice. So you're looking for evidence-based strategies that are culturally competent? Not quite sure about your question. But let me give some thought to that. One of the things that people are finding too as they look at culturally adapted strategies is that sometimes these strategies can be used with multiple populations. I recently read an article which was talking about talking circles, which are often used with tribal groups, and it's a method similar to focus groups or group discussion that really allows for the elimination of a hierarchy. Everyone is on the same level. You sit in a circle. Everyone has an opportunity to speak. The structure itself allows for a beginning ritual and an ending ritual, which kind of brings everything together and helps to maintain that focus. Well, some people have realized the value of using that approach with numerous other populations as well. And so it actually has a wider application than just with a tribal population. And I think as we learn more about... Okay, Alice clarified. Good, thank you. As we learn more about what's effective in terms of cultural adaptation, I think we'll see more of this. We learn from each other. And our learning makes us more effective at what we do. So, the SPIV framework also gives us a lot of opportunities to really implement culturally competent strategies. Let's talk a little bit about evaluation and why that's important. Obviously, when you're adapting a strategy, you're infusing cultural elements into an evidence-based strategy, or you're working to co-create something new with the population of interest, it's important that you monitor your progress. And here I say conduct process and outcome evaluation. Sometimes we go straight to outcome. Let's see if it's working, right? But I think it's important also to monitor the implementation process so that you understand what is working and what is not. So rather than continuing to do something kind of because you have committed to using a particular approach and just continuing to do that to see if it works out at the end may not be the best way to do it. But kind of tracking, checking in with the population that you're working with periodically to see exactly what's happening. You know, how well is this working for you? Or are there some things that we could do differently? So process evaluation is very important. It's always important. I always tell people that you can't really do a good outcome evaluation if you haven't kept track of the process of implementation, because you don't know what's really causing that outcome to happen. You should use your evaluation data. Obviously, check in with the groups who you're working with. Share the data with them. Let them help you interpret what the data means. Okay, I see Darla has a question. Okay, I'll work with Wanda and we'll talk about some resources that we can provide for you. I had an experience when I was working with the American Cancer Society many years ago as an evaluator, and they had a program called Telefriend, and so, I may have spoken of this in previous trainings, some of you may have seen, but Telefriend was a very simple program structure where the idea was you bring in members of the community, women, you train them about the importance of mammograms and how to get a mammogram and etc., and breast health in general. And then you say to them, now go out and tell at least, I think it was 10 friends, what you have learned and encourage them to go get mammograms. Well, the outcome data would be, after, first of all, the process is, did they actually contact 10 people? And then the outcome would be, did those 10 people change behaviors or attitudes with regard to mammograms? It seems very straightforward. Well, one of the things American Cancer Society wanted to do was to adapt those programs to other cultural groups, since it had been developed primarily in a well-educated, white, suburban environment. And obviously they wanted to reach other groups besides those that it was created with. So they brought together groups from different communities. There was a group of Asian advisors, I'll call them, who participated, and there were various Asian ethnicities, Chinese, Japanese, I can't remember, Vietnamese, I think, and Korean. There was also a group of Native Americans who participated as well, and some Alaskan Pacific Islanders who participated in that. Well, one of the things that we found when we looked at the outcomes from the program that was implemented in the Native American community was that, in the first place, the women were not contacting as many individuals in the community as we thought they should, based on previous findings. So there were fewer women in the community actually being contacted. The other thing is that we didn't see a lot of women making the commitment to go to get a mammogram, even when that contact was made. Well, if you look at it on the surface of the data itself, it tells you, well, this is not a program that's going to work with this particular group. It just doesn't work. We got to do something different. However, when we went back to our cultural advisory group, as I'll call them, we shared the data with them, and we talked to them about it. What does this mean? Which is something we often don't do. Well, what we found out were a couple of things. One is that the reservation and the population we were working with was in a rural area, and there was a great deal of distance sometimes between individuals. The other thing was, culturally, the women felt it would be rude just to call some people up, call up friends, and talk about breast cancer and getting mammograms. So what they did, which was more congruent with their cultural values, was to go visit. So they would drive sometimes 40 miles to sit down with a friend, talk about general life in general, and eventually they would get around to talking about breast cancer and mammograms. So obviously that took a lot more time than picking up the telephone and having a 15-minute conversation. So as a result, they were not able to to get to as many of their friends because of the time limitations. Well, we wouldn't have understood that had we not talked to our advisory group. The other thing we found was that the few facilities there were where women could go to get mammograms were typically mobile units. And for this particular group, the mobile unit was 2 trailers, and women were required to undress and put on those horrid paper gowns. Now they have cloth gowns, which are a little better, and then walk, across a little area to the next trailer to get their mammogram. Well, that was not something that women wanted to do, and you can understand how they would feel uncomfortable doing that. It wasn't considered modest, so they didn't want to go get the mammogram. Not because they didn't believe in the value of it necessarily, but because of systemic factors in the healthcare system, which were barriers to their being able to do it. So again, without having the input and getting that additional information, we never would have known that that was the case. The other finding was that in American culture, in Western culture, in the original pilot of the program, the emphasis was on convincing women that they need to do something for themselves because they were important. So do this for yourself was kind of the message in part. Well, in the tribal community, you don't necessarily put the emphasis on yourself, you put it on your community at large. So it's not about what you do for yourself that's important, it's what you do for others and how you support your tribal community. So we moved things around, we changed the language, we allowed more time for them to be able to make the contacts, and guess what? And we also began to work with health providers about the issues with access. It made a huge difference. One of the images that we had on the materials was 2 uplifted hands, which were open, and out of the hands there was what looked like a butterfly to me flying out of the hands, which to many people would mean hope, rebirth, regeneration, very positive kinds of things. And they were very pretty turquoise and mauve colors. It was very appealing to me because I like those colors and because I was interpreting it as a very helpful kind of an image. One of the groups from the Asian communities, and I'm afraid I don't remember which one it was, but it might have been the Pacific Islanders actually, looked at that image and they were horrified. What they saw, the 2 uplifted hands, were disembodied. There was no body attached to the hands, which was a little frightening. What I had and many others interpreted as a butterfly fluttering out of these uplifted hands, they saw as a moth. Moths in their particular culture meant death. So here you have all these lovely brochures and posters with disembodied hands releasing death. And you're talking about cancer. Okay? There's no way we would have known that had we not been able to go back to the community, share these evaluation findings, and get into that discussion about what, from their perspective, what were some of the barriers. So that's just one example of how important it is to engage a community in ongoing planning discussions. And throughout the process of SPIF, with regard to implementation, timing, the structure, the place, all of those things have different meanings for different cultural groups. And I see Wanda's busy putting up some links for you, just to call your attention to the chat, those of you who had asked that question. So, the basic strategy for working through understanding cultural differences and learning how to overcome them by adapting our approaches to be more congruent with those cultural differences really is just about going to the source, bringing the community in and co-creating what will probably be a much more effective intervention by engaging the members of the community. So what we've been talking about really is how you, some strategies that you can use when you're implementing the SPIF so that you can be more culturally competent. One of the things we talk about assessment, and of course making sure that your assessment process is culturally competent and what that means. That may mean using talking circles, which eliminate the hierarchy with where you have an identified facilitator or leader, which is usually the researcher, versus that kind of open and equivalent group where everyone is equal and everyone has an opportunity to speak and share information. That's one thing that you can do around data collection. It's also important when you are collecting data that you identify where the disparities are. And sometimes if you're talking about a small marginalized group, you're dealing with a very small sample size for that group. So really, if you know or you suspect that you're looking at disparities in a particularly small group, one thing you can do is kind of oversample within that group so that you're sure to get the information that you need to make your decisions in planning. That can be very helpful, because the one thing you don't want to do is to not be able to hear the voice of that community or see the need within that community. It gets lost in the data from the majority. The other thing, as I mentioned before, is that even within group, you will have diversity. So even though I mentioned that in this country we tend to lead with our racial identity, for me it's African American, but I've recognized, as I've grown older, that there are many Africans who are now American citizens whose culture and language are totally different from mine. And they are as different from my culture, or the way I was raised, as they might be from anyone else's, even though we share a racial identity. So understanding that will, again, help you to be more effective in terms of being competent in working cross-culturally. And those are just some things that might make a big difference in terms of how you approach cultural competency. As we look at capacity building, of course, training is essential. Self-examination is extremely important in cultural competency. Learning what our reflexive screens are and the limits of our own experience, and being open to hearing from the other perspectives. So that kind of open-mindedness is absolutely critical if you are really wanting to become culturally competent and move along that continuum. Engaging the community and listening to the voices of those that you are focused on for your prevention strategy. Hearing them and providing safe opportunities that are culturally congruent for them to speak to you and to co-create, basically, as you move through the planning process. That input is invaluable. While you're implementing, certainly keeping track of, monitoring progress, looking at quality as you move through implementation. What are the things that are being implemented the way you planned, as well as the way that the program developer might have planned, those core strategies. Is it happening the way that you think it should? And if, for example, you're still not able to retain the participants or recruit them at the level that you think you should be able to, it's time to ask a question. Bring your group back in and say, hey, let's look at this. This is not working. What is missing here? What am I missing? What else could I possibly do to be more effective? And then, of course, ultimately, you want to know whether all of these things that you've done have really made a difference in terms of the outcome. So evaluation becomes very important. And as I mentioned before, both process and outcome evaluation are very critical. So as we move around the SPIF, there are many ways that we can begin to think culturally competently, I guess you could say, in terms of how we move around the SPIF and what we do intentionally in order to understand better the people that we serve. And understanding, too, that, I spoke about life experiences. Well, also things like age make a big difference, the age cohort. We have a lot of conversation about baby boomers versus millennials versus the newer groups, the younger groups, and how we're different in perspective because we live through a different historical context. So history can also be very important, where we come from. And there is historical trauma. You know, people talk about it with tribal populations and the history that they have experienced being a part of and separate from the majority culture. Same is true of African Americans and how they experience the world and what historical attitudes and information have been transmitted across generations. I knew my parents grew up in the South, and they left the South during what's called the Great Migration. They left because Jim Crow was just very oppressive for them. And so both my parents were the oldest in their family. So they came north to New York and began working to bring their entire family. Not very different from what you hear from immigrants. They brought their entire family to New York and got them out of the South. Their perspective of America and what I learned from them, from their history, led me to have certain types of attitudes about certain things. You know, some of them were biases, and we talk about racism as being something that only people in power can have. Not so. Because we all have misconceptions. We all can adhere to stereotypes and not often even recognizing that they are stereotypes. But it took my whole life experience growing up in New York and then moving back to the South to begin to understand how some of these factors had affected my parents and how they affected me as well and have changed my attitudes towards many things. For those of you who are interested, I recently started reading Ibram Kendi's book, How to Be an Anti-Racist. And basically what it says is that you need to be vigilant. You need to make an effort to look for the places where there is discrimination, where there are disparities, and then be an activist in terms of trying to correct them or trying to devise strategies which will decrease that disparity that you've identified. It means taking action. It's not an attitude alone, but it's being able to do something with that knowledge and with that attitude. So that kind of winds up what I wanted to share with you. So I'd like to open it up to questions, and you can use the chat if you still have some additional questions that you would like, or some comments will be fine. And Wanda, I appreciate you helping me to kind of make sure I don't overlook anyone. Okay, Concha says she's glad that evaluation is being included as it relates to cultural competency. When the model was developed, evaluation was in the center with sustainability and cultural competence. Yeah, I think evaluation is one of the, well, I'm an evaluator, but I'm going to say it's one of the more important steps in the SPIF, because how else will you know that you've made a difference, which is why we all get into this profession, right? And Concha agrees with me. Any other questions or comments you'd like to make? I think we have about 3 minutes. Am I right, Wanda?
Yes. I think it was Carlton that Carlton Hall was one of our trainers for another training, and he said, that he thought probably every trainer of each one of these thinks their topic is the most important. So definitely yours is evaluation, because you're an evaluator.
There you go. That's my bias.
Yes. We're glad you enjoyed it.
I see people are typing.
We have an evaluation for this training. How do we access that? Can you put the link up in the chat? Yes, we'll put that up in just a second. Any other questions for Iris? We went through some really great material, And again, you'll receive all of that by email if you're registered for the training. If you haven't registered yet, make sure that you go back and do that, so you'll receive all the information and receive a certificate as well for participating. Okay, so there were several questions about evidence-based programs, and I put up a few links, but I want to encourage you to do a little perusing on the PTTC website. I've seen a lot on there lately as I have, as I've been kind of going through the website for different reasons, but make sure that you get in there and take a look at what's available. And again, take a look at the PFS Academy SPIF series on the South-Southwest website. We have several resources that, in addition to what we've provided for you, the recording for the training will remain up there, and lots of other resources and tools and examples for each one of the steps of the SPIF. So we want to encourage you to go to our website. We've done a lot of work to include additional resources for you. That's a good place to start. And we have several resources available for this topic as well. So thank you, Darlene. You're one of the ones that have attended all 7 sessions. That's awesome. Okay, so here's a question specific to American Indian population. Do you have other examples like talking circles?
I have some articles I can share with you, and I will give those to Wanda, and she can also share. Oh, a lot of the cultural adaptations have not really been fully evaluated, but there's a lot of promising stuff out there. Talking circles is one more people are familiar with, but I'll certainly share some of my sources.